About 20 minutes now after 5 o'clock. This is the afternoon edition on CBC Radio 1. Well, we've heard a lot about children heading back to class next month, from how schools will handle class sizes to mask policies to fears surrounding immunocompromised children and staff. But what about testing in schools? Kyle Anderson has been looking into the issue. He's a biomedical professor at the University of Saskatchewan, and he thinks pool testing, or surveillance testing as it's sometimes called, is an effective way to keep COVID-19 at bay in our schools. We've reached him this afternoon in Saskatoon. Hello, Professor Anderson.
Hi there, Garth. Nice to be here.
Well, thanks for your time. First off, why is it important to test students in school as opposed to just letting them get tested outside of school in the public system?
So right now, our testing system is usually based on contact tracing. So we think that someone's been exposed or they've got some kind of symptoms, but we have a particular reason to test that individual. And one of the problems with schools, or just children in general, is that the number of asymptomatic or pre-symptomatic, so kids who could be infected and actively spreading the virus, because they're not showing symptoms and maybe they haven't been in known contact with other individuals, they might be spreading for an extended period of time before we have any awareness that that's happening in the school.
Okay, what is pool testing or surveillance testing, and how does it work?
Okay, so pool testing has been used for various testing things for 50 years, but if we want to think about sort of COVID-specific pool testing, it really came about because of a limited amount of tests that can be run each day. Swabs were in limited supply, the reagents, the people to actually run the machines themselves, and the concept was, for healthcare workers, we want to be able to test every doctor at the hospital every day, but we can't dedicate that many tests to our doctors and our nurses. So what they said was, well, what if we swab 10 doctors and test all of that as a single sample? If that single sample comes out negative, we know all 10 of those doctors were negative, and we've saved 9 tests because we've done 1 test instead of the full 10. If it comes out positive, then yes, you need to test each individual, but it works as a sort of surveillance to let us know that there might be a problem before that problem sort of accelerates into something that we can't control. And right now in Saskatchewan, we've got a lot of students going back to school and no ability to test all of them unless we do some kind of pooled or aggregated testing like this.
Could this same sort of testing be used for teachers and other staff as well?
Absolutely. I think that pool testing is a scenario that we should be using. If you sort of think about our daily budget in the province of how many tests we can do, we should be trying to utilize all the tests we can. And if that includes testing hospital workers, testing children at schools, testing teachers, testing factory workers, wherever we have large numbers of people aggregating, if we do this kind of surveillance testing, then we won't have to wait until we discover an outbreak, because we'll catch it when it's just a few individuals.
Now, the province's Chief Medical Health Officer, Dr. Sask Shahab, was asked about the idea of pool testing yesterday, and here's what he had to say.
We already do surveillance in schools every year. In flu season, we do surveillance for all types of illnesses, and COVID will be added to that surveillance. It won't necessarily involve testing per se, but obviously, whenever children test positive or staff in a particular school, that's added to our surveillance algorithm. But if required, especially if there were cases of clusters in schools, broader testing may be considered. So it would certainly be considered in those situations as well at this point.
So, Professor Anderson, what are your thoughts on that?
So one of my thoughts is that while we do surveil students for symptoms, looking for runny noses and things like he said, we don't have that with COVID all the time. Sometimes up to half of individuals with COVID are completely symptom-free, or at least go a week before getting any symptoms where they're shedding virus. And this is a disease where we don't want it to start to be community spread, where students are getting their parents sick, their teachers sick, because the adverse outcomes are 100-fold higher for having to be hospitalized or even death when it comes to students getting adults infected. And yes, if we just said, it doesn't really affect the kids that much, they get runny noses, they get a cough, they get better, then maybe we wouldn't need to do this pool testing. But I think one of the great fears is students are these vectors of disease to sort of get the adults sick, and that's where the worst outcomes are. The other thing that he said was sort of, if we get outbreaks, then we'll start to do surveillance testing. What we should be doing is as much testing as we can and as much surveillance early on, and then if things are good, we can scale back. But once the genie's out of the bottle, once we start getting outbreaks in schools, the school has to be shut down. There's cases of schools in Israel where by the time they found 2 cases and they tested all individuals, there was 180 people sick, staff and students at this school. And by the time, that was really sort of the start of the second wave in Jerusalem of cases. Or at a sleepaway camp in Georgia, they had all the students or all the children and all of the camp counselors tested 12 days or under before the camp started. And because they only did that sort of snapshot in time, some people got infected after their test. And when they went to camp, they found that a quarter of the people at this camp ended up getting COVID. So if we aren't continually monitoring, that's when our outbreaks are going to become a lot more spread, a lot more students and parents and teachers all getting sick.
Well, what do you think should be done if a student does test positive in a class?
So if we're doing surveillance testing and early testing like this, when a student comes up positive, there's a good chance they haven't spread it to many individuals yet. So we could try to isolate their cohort, whether it's the high school students who are sort of working together through certain courses or grade school kids who are in an individual classroom, and say, we need to now test each of those students and the close contacts, the teachers and things like that. But the other classrooms are probably going to be okay because they've been in different rooms, they've been isolated. If we aren't doing surveillance testing, then, maybe they've already spread it to individuals. But it's really about trying to catch things as early as we can.
Finally, another thing that could spread the virus, well, according to some studies anyway, is ventilation in schools. What can be done to prevent that sort of spread?
Yeah, so if you think about any sort of disease management, we want to be able to monitor as quickly as possible or as early as possible and also slow the spread. And these two things go hand in hand. If we can slow the spread of the virus, then our monitoring is going to be more effective. If we're monitoring more effectively, then that tells us when we need to hit the brakes and actually do more measures to slow the spread. So ventilation and masks are the two things that we can really do in classrooms to try and reduce the transmission. So it's wonderful to see that many of the school divisions have started to say that, yes, we are going to be starting at level 2. We're going to be mandating masks. And the second part of that is ventilation. If we can open the windows, we should. If we can boost the airflow in any of our buildings, we should. If we can have students outside, we should. But that's only going to work for the early fall because once the weather gets cold, we're breathing a lot of recirculated air. And then if there is a sick student, there's much higher chances that they're going to be spreading it to other students or teachers.
Before I let you go, I understand you have kids in both high school and at elementary.
Yes.
How do you feel about sending them back?
I really try to be realistic and not sort of buy into the fear too much. And, I've continually look at the sort of data, the statistics for different age groups and things like that. And I know that my kids, if they caught COVID, would, 99% of the time or 90% chance, they will be perfectly okay. But for myself, in my age group, I probably have about a 5% chance of being hospitalized and, maybe a 0.5% chance of death from COVID. So I know that my kids will be okay. But what happens if they bring it home to me? And that's sort of, I think, what a lot of parents should be more focused on is that kids are low risk, but the risk is that the kids will spread it to their parents.
Professor Anderson, thank you so much for the conversation, and thanks for your work.
Thank you. I'm glad we're talking about this.
Carl Anderson is a biomedical professor at the University of Saskatchewan. You can get more details on this story on our website, and that's cbc.ca/sask.